So tonight, CBSN New York is airing a new special focused on mental health. Anchor Cindy Hsu will share her personal story of dealing with a mental health crisis and her journey to recovery. The special will also feature conversations with experts about coping. So Cindy is with us now to give us a look ahead at this special. Cindy, I can't say thank you enough for being vulnerable enough and open enough to talk about your journey. I think, and in terms of depression specifically, I've always felt like that it was this sort of this unspoken modern day plague, and no one wants to talk about it. And so you have this idea of what depression looks like, and we don't know that it looks like me and you and our coworkers. We often don't recognize when someone's suffering. So can you just quickly, tell us kind of a little bit of your story, just how you realized that you were going through a mental health crisis and what actually happened?
Well, Anne-Marie, I've been a journalist in New York City for nearly 30 years. So, I'm on it. And then about 5 years ago, I started not being able to remember things that well. Everything was really slow. I couldn't do a story as fast as I used to. And then my heart was always beating. And one day in the news truck, I ended up getting so anxious and just, I went to the emergency room and doctors couldn't find anything wrong. So that was, frustrating. Went back to work and just kept getting more and more anxious and stressed and not being able to do my job. And then one day a colleague came up to me and said, "Are you okay?" And I wasn't. And I finally broke down in tears and left work. No one knew why, because as you said, everyone keeps it a secret. And things just kept going downhill. And it went to deep, dark. We're talking suicide attempt. We're talking psychiatric hospital, and then recovery, which is really what I'm focusing on, is that so many of us are going through these different things, especially with COVID and the isolation, and yet we need to talk about it or else you can get in that big danger zone where it's too late.
Yes. I've had very close family members deal with depression, and when you're in that dark place, it feels like you can never come out. I think it's really important to underline the fact that there is recovery, that there are ways to claw your way out of it, and there's a lot of people to help. You did not have to share this story. Why are you choosing to?
I think we, first of all, as you know, we do so many stories about mental health and the stigma attached to it. So I felt like here I am presenting this news on my newscast and at the end saying we need to break down the wall. What am I doing to do that when I'm keeping this secret? So part of it was, I need to do something. I need to share this. I've been hiding this for years and years. Even my co-anchor didn't know. My office mate didn't know. My best friends, for years, they didn't know. So the other thing is with COVID, for the last year and a half, we've all been suffering some sort of anxiety. And I think everyone can really relate to just not feeling very good and very, I don't know, you just don't know what the future holds. So I think this is a time where we really need to open up and share with people. Like you said, there are so many resources. I mean, when I said a psychiatric hospital, I think the only thing that we can look at are things on TV, like movies that make it look so scary. And yes, when I first went, it was really scary because I didn't know anything. And we need to open that door to say, this is what it's like. It has psychiatrists and psychologists. It has group therapy with people who are just like you. And it actually helped me. It helped save my life.
Yeah. I want to play a little bit of a preview clip here of what people can see later on tonight.
Isn't there a fine line between giving ourselves grace and not telling somebody I need help?
That is such an important point. So sometimes, because mental wellness has a taboo, no matter who you are, white, black, Latinx, Asian American, Persian, there is a stigma about it. So we want to make sure that when we're talking about grace, we're paying attention to our own insecurities about not just the mental health of our loved ones, but about our own. Because sometimes we're like, I'm not going to push that person because I'm sitting here in my own fog, or I'm sitting here in my own addiction or my own depression. And we have a resistance to actually pushing someone and say, oh, we'll give them some grace. The grace I was speaking of is making sure we're not too blaming of ourselves on this road, but we have to ask these hard questions. We have to ask our loved ones, are you in pain? Do you want to hurt yourself? Here's an even tougher one. Do you want to kill yourself? Remember, do you want to hurt yourself and do you want to kill yourself are two very different questions.
So when I, first thought of grace, I thought, often we don't give ourselves grace and we think, well, everyone else seems to be juggling all these other elements of their lives. I don't understand why I can't handle this. But he kind of spoke a little bit differently, and it actually took me back to when I was dealing with my own family member's depression, and I didn't know what to say. I didn't know how to ask, why are you in the bedroom all day long? And I have felt guilty ever since that I didn't understand how to make that approach. So when you hear grace, I'm sure it means a number of different things when you hear give yourself grace. But how do you interpret what the doctor said?
I think he's saying that, and I think we look at it through this lens. If your friend was going through this, how would you talk to them? You would try to lift them up as much as you can. You would do anything you could to help them. But if you're going through something like that, we don't help ourselves. And I think it just is so smart to think, how would you treat a friend who is going through this? And that's how you need to treat yourself. Grace means so many different things to different people. For me, it means forgiveness. It means giving yourself a break, taking care of yourself. And we all need to take care of ourselves, because you can't take care of your loved ones if you can't take care of yourself. And Anne Marie, I just wanted to say that this special is not just for people who are suffering themselves, but also like you, somebody who had a family member who is suffering that you don't know how to reach out. And I think Dr. Grant's point was, we need to be very direct. You can't beat around the bush. You can't wonder, oh my goodness, I hope they're okay. You need to be straight out and sometimes ask, if it's really bad, are you thinking of taking your life? Are you, that does not make it so that it's going to cause them to do that. That studies have shown. So people are so afraid of facing this straight up, but you need to.
Yes, because they're not in a position where they can reach back out to you easily. So you need to be relentless. You need to let them know that you are there. You need to ask the question over and over and over again, even if they don't respond initially, even if they say, I'm fine, and you know otherwise, ask again. What are some of the resources the experts that you spoke with suggested for people who may be dealing with mental health crisis of their own?
Well, first of all, I was surprised to find there were lots of resources, because you don't really learn about them until you are in this world. And there are, crisis hotlines and text lines, which I know you're going to show. There are also just so many organizations. When I was getting well and I left the hospital as a journalist, the first thing I did was start researching, oh my gosh, who else has gone through this? What are their stories? And there weren't that many people telling their stories. Mike Wallace, the 60 Minutes legend, told his story, and that meant so much to me that I could find that on the internet. But that's from years ago. So that's another reason I feel it's important to talk about it. But there are a lot of agencies. The American Foundation for Suicide Prevention was one that I found on the internet. NAMI is another one. It depends on what state you're in, but there's state help. But the biggest thing also is just to tell people it is not a weakness to ask for help. It takes courage to ask for help. And this is no different than if it was a physical ailment. It's your brain that's hurting, and you don't see the scars as if you had cancer or diabetes. But we need to take those important steps as if it was just any other ailment that you have.
I remember that Mike Wallace interview as well, and it was transformative for me. I think that's such a great point, that just because you can't see the scar doesn't mean that it's your fault or your weakness. And there's so many options out there. There is recovery, and I'm very happy that you are healthy and happy and able to kind of spread this information to the people that are in need. You're really going to make a difference, Cindy. Thank you so much.
Thank you, Anne-Marie.
So you can hear Cindy's full conversation with Dana Tyler at 5:25 on CBSN New York, and at 7 p.m. you'll get another chance to stream it, followed by conversations with mental health experts. If you or someone you know is experiencing suicidal thoughts, call the National Suicide Prevention Lifeline. It is on your screen. That number is 1-800-273-8255, or you can also reach them online 24 hours a day. All right, it is 7:59.